Hey guys, me Hunter, and I had a health scare. My bladder was malfunctioning, believe it or not. I didn't know why, so I had to go through all these tests, extensive testing, especially when a doctor said, well, I could have cancer, and it could be due to testosterone, which I didn't think so. I don't know. I never heard of that. But, I definitely wanted to get tested. My bladder wasn't emptying all the way. Uh, so I had frequent urination and burning, which sounds like a bladder infection. So of course I was tested for that first. I didn't have it. I've had them before, but this time I didn't have any bladder infections. So my primary care doctor, she sends me to a urologist and a gynecologist. A gynecologist of all places. That's the first place she sent me to was the gynecologist. The gynecologist didn't know why I was there. She saw my chart that I was transgender, so the first thing she asked me to do was remove my shirt. Please remove my shirt so she could do a breast examination. Which, took me back because I've had two top surgeries. But I thought, okay, if that's what she needs to do. Because there are some men, I've heard some men have had breast cancer, had lumps, whatever, so I thought well, maybe that's what she's talking about. I took off my shirt and the nurse, her jaw dropped, and the doctor, both very surprised, taken aback, said, "Oh, sorry. Oh, but that's a nice surgery you had there." I'm like, "Oh, okay. So you don't want to do a breast exam?" And she's like, "No, I don't need to. I didn't know." But like I said, I was very flat chested. I didn't understand the asking where these people were getting their information. Then she's like, "Well, I don't know what you're doing here, because I said a pap smear, because I remember getting those, God forbid, you know, before I transitioned. And she said, I, there's no need to do one of those. You don't have a uterus. I said, right, I have a uterus. I don't have any ovaries. She didn't know what I was doing there. I said, because my primary care doctor sent me here to see if you can find anything wrong with my bladder. And she said, I can't. You have to, everything looks fine. You're going to have to see a urologist. I said, yeah, I have an appointment for that. So I went to see the urologist, and he said, well, I looked at your test when you had the CAT scan done at the hospital, and I don't see anything wrong, so there could be cancer, and you're on testosterone. I'm like, yeah, but I don't. Does that cause cancer? And he said he didn't know. So I had to wait 2, 3 months. Again, it was been a long time. I had to wait. They canceled on me once. I had to wait another month, not knowing if I had cancer or not. So I go in there, and the prep nurse, first thing she asks me was, did I have a vagina? I mean, she didn't come out, and it was just an odd question, and I thought, well, that sounds rude. I said, why, do you? And she kind of laughed and said, yeah, but we need to know if you do. And then I said, well, I kind of knew why, but I just kind of messed with her, joked with her for a while. Finally, we got past that, because she needed to know if I had a penis, because she needed to know were my legs going to be in the stirrup, she said. Or am I just going to be laying there and they're going to be putting this is very, very invasive. Uh, Putting the scope through my penis or putting it through my vagina. So she needed to know that before I went into the other room where they do the test, where the doctor was. So I go in there, go to the other room. There's like 4 to 5 nurses, and I felt a little embarrassed, but then it was odd. It was just very weird, and it felt a bit awkward, because these nurses, this, I don't know how many trans guys they've seen um, getting this type of test. I thought it was gonna hurt. I've had scope, bladder scope done about 11 years ago, and if anybody's ever had one that's watching, It could be painful unless you go under the knife, unless you get put out. And they didn't do that. He didn't do that. He just used some numbing gel. So it only took about 4 minutes, so it didn't really hurt, but just a little bit. And I could see my bladder on the screen. He's like, "Do you see your bladder?" Yeah. "You see inside your bladder?" "Yes, I do." And he's looking all around. Uh-huh. And then after he was done, he started to leave. Well, he said, "I don't know what's wrong." I said, "So there's no cancer?" And he said, "Nope, nope, no cancer." So that was a whole happy day for me. Didn't have cancer. Didn't have to worry about that. But he didn't know what was wrong with my bladder. So, and I've been talking about my bladder forever. So that's why I came on here to tell you guys that I had a health scare, and doctors trying to blame testosterone. I have heard something. I don't know where it was, online somewhere, where I yeah, I remember it. I remember it. Some woman, like, she knew all about testosterone, said it could cause cancer. But I don't know who she was. I think she said she tried testosterone. She didn't pass at all. So I don't know who that was, but I think that and some young guy, young trans guy. But that's it. I don't know where they got it. Maybe they were misinformed. Maybe they were on testosterone and so they had cancer, or they heard about it. So I don't think anybody should be on here talking about testosterone gives you cancer, uh, for sure, unless you're 100% sure. That's what I had to say about that, and I'm not going to stay on here very long. And by the way, this camera makes my hair look yellow and my beard, and it's not. It's blonde and brown. So I'm I've thought about, I'm not gonna go on here because I didn't dye my facial hair yellow, and I didn't dye my hair yellow. So I'm gonna go. If you guys have any questions, put them in the comments below as always, and I'll see you next time. Um, please subscribe if you haven't, and I'll show you my top surgery results. I'm not gonna do that right now. I'm gonna do it when I'm sitting in a different chair, and so I'm not just leaning back and uh, you know, showing you something that's not really the way it looks. So when I'm sitting up, I'll show you a different time, and I'll out. I'm gonna go. See you next time.